Hi, I'm Dr. Ed Cusick, and again, I was one of the that worked on your child to do the revisions. And a lot of you, and I have Courtney Mars with us here also. So we're both trained in myofunctional therapy. We started doing this just because we've had a lot of older children that just because the revision was done, it just doesn't keep the tongue in the correct position. And they still may have some airway issues. So, Courtney, you could probably speak a little bit about the airway issues that you experienced because of the restriction.
Yes, so I had some upper airway restriction that I was dealing with, and my sleep study showed that I was struggling a little bit at night getting air. So I did some laser snoring therapy with Dr. Cusick, and that helped elevate my soft palate, and it actually reduced my episodes I was having at night by around 60%. So I have been getting much better sleep now since I did that.
And then would go with us going through the program for myofunctional. I'm sure you were doing some of the myofunctional exercises too. And did you find those beneficial?
Yes, so one of the big things that we shoot for with the myofunctional therapy is trying to keep your tongue suctioned to the roof of your mouth all day. So when we initially started the myofunctional therapy, I realized that there were times throughout the day where I either would have that the low tongue posture, or where my mouth would slightly open a little bit if I was relaxed or in the middle of something. So now I've just learned to be more aware about that, and the exercises definitely have helped so that you are doing these things, keeping your tongue up throughout the day without having to think about it so much.
So just doing the revisions though, isn't the whole thing once the child is a little bit older. So that's why we've incorporated that in here in our office. That kind of differentiates us from other offices. So we want to go through some of the exercises that you're going to be doing. So basically, first is that you want to demonstrate the brushing of the tongue.
So the first exercise we have you do is you'll brush the tip of your tongue 5 times. So that tip of your tongue, and then you also want to brush right behind your 2 front teeth on the roof of your mouth there. And then you want the tip of your tongue to go on that spot right behind your 2 front teeth where you're brushing. And the tactile sensation on your tongue from the brushing and then on the roof of your mouth helps your brain actually remember that those are the spots that you're supposed to shoot for.
So again, we'll probably want you to start out maybe try doing that multiple times during the day, maybe depending on how old your child was, but about 30 seconds, maybe 3 times a day that they can touch that spot and leave it there and close their mouth. So another one is where we call clicking the tongue. So if you could demonstrate that one for us.
You want to try to get a little bit of a suction on the roof of your mouth there, and that's just another way to help remind your tongue on where it's supposed to be, and it's a little bit of a test on how well your tongue mobility is as well. So,
and again, we'll want you to do that for about 30 seconds daily. And then how about cheek puffs?
So the cheek puffs, you want to put the air in one side of your cheek, and then you'll switch it to the other, and then you'll switch it to the top and to the lower as well. So I'll demonstrate that. And then you want to try to keep your lips sealed while you do that.
And tongue in that one spot.
And your tongue on the roof of your mouth as well.
Yes. So again, all these things are helping training that tongue to stay in the right spot, and that's going to help with the airway. And the last one is lip traces.
So the lip trace, you want to just run your tongue around in a circle along your lips while also trying to keep your jaw still. So. And then you'll do that for about 30 seconds, and we can increase the time as we practice and keep going.
So yeah, it's an ongoing thing. Some of you, your child may be 8, 10 years old, so we've got a lot of retraining to do. So all these things just need to be keep doing, and Courtney's going to be evaluating them. We want to have them back into the office, after I've seen how they're doing the revisions, just making sure that the tongue function is correctly.
Yes.
All right, thank you, and
Thank
thank you for allowing us to treat your child.